What's up, everybody? How you doing? Thank you for joining me. My name is Fitz, and I am an acupuncture physician. And I'm gonna go over some not breaking news, but great news about research with acupuncture and depression and anxiety. Now, we all know that some of us do suffer from depression and anxiety, general anxiety disorder that can lead to panic attacks. Right? Me myself, I experienced a panic attack right after I finished acupuncture medical school. I graduated. I got my degree. I got my license, and 2 weeks later, for some reason, I just got a panic attack, and it's scary. It's scary. So ever since then, I told myself, man, I gotta try to help people with this condition. And one thing, and the more research I've done, and the more I've gotten to know how acupuncture works, the better I'm optimistic about that. I think I could be able to help people with general anxiety disorder, depression. Now, for those of y'all who are unfamiliar with acupuncture, acupuncture has been around for thousands of years. The Chinese discovered acupuncture, and what's great about acupuncture is that in this modern day, right now, there's tons of research that's being done on acupuncture, on the points, and scientists and doctors in real time are seeing the effect of acupuncture. And so there's a whole bunch of research being done on acupuncture points for different disorders, different ailments, of course, for pain, for migraine, menstrual issues, infertility. The list goes on and on. But for this podcast, for this video, I'm going to focus on acupuncture for depression and anxiety. So the great news is research shows that acupuncture, especially electrical acupuncture, can work just as good or even better than some antidepressant drugs, which is great news because we all know that even though these drugs can help people with depression and anxiety, they do come with side effects. They do come with side effects, and some of the side effects are very severe, in my opinion. Where acupuncture has minimal to no side effects. Okay, so that's the great news about it. And there's certain points in acupuncture points that's been pointing out in research to have great effect on depression and anxiety, especially combined with electrical acupuncture. Electrical acupuncture is basically where you put acupuncture needles at certain points of the body, and then we connect wires to them with different frequencies. And depending on what frequency it is, it can help, you know, the condition that we're trying to treat. So the mechanism of action for acupuncture is actually kind of interesting because number one, it's a neurotransmitter regulation. That's right. Electrical acupuncture directly influences the levels of key chemical messengers in the brain that are implicated in mood disorders. Listen to that for a minute, okay? I'm gonna say it again. Electrical acupuncture directly influences the levels of key chemical messengers in the brain that are implicated in mood disorders. Okay, monoamines. Okay, electrical acupuncture is shown to increase the expression of monoamine neurotransmitters, including, get this, serotonin, norepinephrine, dopamine. We heard these terms before, we heard these words before, but this is actual research proof that these acupuncture points, especially combined with electrical acupuncture, can at the cellular level treat depression. Again, researchers are saying that in a lot of cases, acupuncture can can replace antidepressants for some people, or at least work side by side with them. All right. Now we all know serotonin is essential for regulating mood, sleep, and appetite. Okay, serotonin again is essential for regulating mood, sleep, and appetite. Norepinephrine, all right, is involved in arousal and stress response. Dopamine, we all heard of dopamine. Dopamine release, dopamine. This, of course, dopamine is related to pleasure, reward, and motivation. And electrical acupuncture research shows actually influences the levels of these chemical messengers. I.e., if done properly, acupuncture can help improve your mood, improve your depression and anxiety. When years ago, when I decided to become an acupuncture physician, Some people ask me why I didn't become a medical doctor or even a veterinarian because I used to work with animals. And I said, I got no issues with those fields, but I like to do things naturally because our body does a wonderful job treating ourselves, but sometimes it needs help or sometimes it gets out of balance. So I chose acupuncture because acupuncture uses the body own healing process just to get it back in balance without any major to no side effects. So this is another example of how the deeper I get into this field, I've been practicing acupuncture since 2014, and the fact that it can treat depression and anxiety, that is that is huge. That is definitely huge. And now I want to go over the general anxiety disorder part of this. Okay, so your research shows that acupuncture can also treat anxiety. The more I talk to patients or just people in general, the more I find out that a lot of people are suffering from some form of anxiety. Now, I mentioned before that I actually got a panic attack weeks after I graduated acupuncture school. And let me tell you, it feels like the walls are closing in. And it happened again the following day until I figured out that there's nothing going on. What do I mean by that? When it comes to anxiety, I gotta go back for a minute. Our body works on this mechanism that's called fight or flight. We all know about that, okay? Sympathetic, parasympathetic, okay? Sympathetic system is like, fight or flight. Parasympathetic is rest and digest. Or a panic or so what anxiety is, and in some cases what a panic attack is that when the fight or flight response just gets out of whack, your body perceives a danger that most of the time is not there. What do I mean by that? Some people are claustrophobic, some people worry a lot, some people worry about bills, this and that, and then they could become very anxious or have anxiety that can sometimes lead to panic attacks. But what your body is doing is activating the sympathetic nervous system, the fight or flight. Okay, doing the sympathetic nervous system activation, your body is getting ready to quote unquote fight the potential danger or run, flight. So that means your blood pressure goes up, your heart start beating, start sweating, stuff that's very similar to an anxiety attack, correct? And research shows that acupuncture can help tone down that sympathetic response and kick it to parasympathetic. Okay, acupuncture has been known to stimulate the vagus nerve. The vagus nerve is a nerve that starts off, is one of the cranial nerves and basically runs through the body. Also affects digestion. So when it comes to the parasympathetic system, that's the rest and digest. So in essence, after you fight or flight from the danger, now you rest and digest. So that means that now you're able to relax, heart rate slows down, blood pressure drops back to normal, and you just relaxing and chilling. Acupuncture, especially electric acupuncture, can help your body go back into that rest and digest mode. So here's a here's something all y'all could try at home. For those of y'all suffering from anxiety and or panic attacks, anytime you feel your mind going to that place that might put you over to the anxiety level, try this. Just literally tell yourself, just talk to yourself. Say, self, I know what you're doing. Hey, brain, I know what you're doing. It's not going to work. It's just my brain playing tricks on me. And believe it or not, for that moment, that anxiety goes away. Part of the reason your brain goes there, starts thinking too much, is that, it's trying to trick you into something. If you if you catch it early and realize that there's no perceived danger, there's no reason to be anxious for anything, just literally talk to yourself. Just say, hey, brain, I know what you're doing. It's not going to work. Okay. And the anxiety will go away. I've done it many times to myself where I felt anxiety coming on. And I told myself, wait a minute, self. Okay, brain, I know what you're doing. It's not going to work. And believe it or not, in a couple of minutes, maybe the most 5 minutes, it goes away. So that's a little hint y'all could do. That's a little tip y'all could do. But I recommend, if y'all live around an acupuncturist, if this acupuncturist is in your town, I say visit him or her and ask about depression and anxiety. If you're taking medication for the depression and the anxiety, us as acupuncturists, we cannot tell you to stop taking it. The doctor who prescribed the medication has to decide if they want to keep going or not. But what we could do as acupuncturists is do our part. We could put certain points. Now, certain points in research that's shown to work well on depression and anxiety, especially with electroacupuncture, is do 20. Do 20 is located on top of the head, right in the middle of the head, basically. Yin Tang is also a good point. Is located right in the middle of the eyebrows. PC6 is located right above your wrist in the center, in between those two tendons. That's a great point for anxiety. Great point. It's called PC6 or pericardium 6. Heart 7 is also a wonderful point for anxiety. Spleen 6 is also good. These points have been shown in the research along with electrical acupuncture to help tremendously with anxiety. So that's all I got to say right now. I'm very excited. I'm very excited to treat more patients for anxiety and depression. Just know that if you're suffering from anxiety and depression, there's hope out there. There's help. Okay? Acupuncture can help. If you are in the Miami area, you can always call me. I have a clinic called, Acupuncture Miami VIP. I am doing house visits right now until I build my clinic. I am in the middle of building my clinic up. And my clinic is going to be a place where you can come, just relax, and just have that cool vibe, okay? Please, if you haven't already, subscribe and like, and let's build this community, okay? Let's build this strong. And remember, if you're suffering from anxiety and depression, you're not alone. You're not alone. I've gone through it, and at this moment, I'm not in this state anymore, and I want to help as many people as possible. Thank you for your time.